About. So our next presentation, we'll be hearing from Nic again. We spoke to Nic earlier, and it's great to have you back again, Nic. Nic is another key vet at Red Wings. Nic is responsible for behaviour at Red Wings, and that must be quite a job, Nic, I'm imagining, with so many unhandled, feral, mistreated horses. So he oversees the team that, get them back to where they need to be. And today, Nic is going to be talking to us about what we can learn from COVID to apply to help keeping our horses healthy in regards to strangles. So COVID hasn't been ideal in some respects, Nic. I can't wait to hear how we can take some positives for our horses.
Thank you. Can you hear me all right?
Yeah, we can hear you great. Thank you.
Lovely. So I do apologize if there's noises in the background. It could be that the puppy wakes up, and then I do apologize. I'll do my best that she has a good rest.
Don't worry, we had Nicky's snoring dog earlier. That's absolutely fine.
So thanks very much. I know I've spoken to some of your delegates in the past about strangles, and I think we hopefully can just look at what started as a conversation with Dr. Andrew Waller, who was at the Animal Health Trust during the early days of COVID, and just see whether or not we can learn some lessons from our own experiences of COVID and apply those to the prevention of strangles and possibly also managing it if we're unlucky enough to have an outbreak. I'm very happy to take questions or be interrupted during the talk, and I'm also very happy if we're running out of time. I've got a few videos at the end to show you the sort of work we do to try and get some of our longer term cases back on their feet. And those are sort of ones we can always cut short if we're running out of time, so don't hesitate to interrupt. What I'm keen that we can sort of pick up from this talk today is opportunities for us to learn. And I think it's looking at the similarities between a disease like COVID and strangles and the differences that will make us much wiser in how we cope with future disease threats, not just to our own horses, but maybe to livestock and pets that we are caring for and in our community, and maybe to understand things like the restrictions that come with avian influenza. And I think looking at diseases like COVID also gives us opportunities to find new solutions for diseases like strangles, where maybe we've stagnated a bit and we can suddenly see new light. So in terms of the bugs lying behind it, COVID is caused by a coronavirus, which is one of a large group of viruses. Strangles is caused by a bacteria. People often say the word virus, and they often say things about strangles that actually refer to viruses and not to bacteria and not to strangles, but that still doesn't detract from a lot of people having a really good understanding of the disease and this bug that spreads the disease, whether they understand it as a virus or not. Interestingly, both these critters are not that strong when they're outside of their target organism. So they have a need to move from one host to another in order to survive. And it's usually when they're inside a host that they are at their most powerful and able to last longer. And we'll see that strangles have developed a very particular way in which it can ensure its own survival. Interestingly, strangles, for example, a large amount of it in a lump of pus that's been snotted out of a horse's head into a moderately cool and damp environment, so maybe under a tree trunk in a field, is likely to survive a lot longer than if it's coughed out onto a concrete pad in the middle of summer. And I think it's important to recognize that just because it's a weak bug outside of the horse doesn't mean that it cannot survive for longer periods. So our biosecurity, our hygiene, our disinfection does always need to take into account the other circumstances, like the time of year. So, as I've already alluded to, strangles is a bacteria, and it moves by direct and indirect contact, normally in the discharges coming from a sick horse. And COVID, you'll see throughout the talk that the information down the left-hand side of the screen will refer to COVID and the stuff on the right will refer to Strangles. I've saved space by not doing that every time on every slide. But the diseases do require the presence of a host within reasonable striking distance, but COVID can travel on the air and be inhaled by the next patient or victim or host. And Strangles will either need direct nose-to-nose contact or indirectly through the second horse licking your overalls that are contaminated with pus, or sharing a water tank, or sharing a feed bowl. And so the images really illustrate the fact that we're looking at a group of horses, and it's both diseases are diseases of a population. The middle picture shows that we go to quite extraordinary lengths with quarantine and biosecurity when we have when we have a threat of an active infection. And the picture on the right shows the contacts that we managed to identify to the 2 horses that we've picked up in our outbreak here at Red Wings in 2015. These were the index case, or the first case. So Cal and Smarty would be our Wuhan, and they were then in contact directly and indirectly with a whole host of other horses through fields and gates and transportation. And you can see that actually the disease can spread really easily, because we often underestimate how much contact our horses have with each other just in our normal day-to-day lives. Diagnostics. In order to know what we're dealing with, we can of course go on clinical signs, but as we know from COVID, the symptoms in a healthy young adult could be very similar to a minor cold or a case of flu. And in an older person, influenza and COVID can both be equally devastating. So symptoms alone for COVID are not good enough. And with Strangles, we always relied on the classic signs of abscessations under the jaw and pus bursting out through the side of the head and coming down the nose. But actually, the more we've been able to diagnose non-obvious cases, we've seen that Strangles is actually much more variable. And a lot of cases that we wouldn't diagnose on clinical signs of Strangles turn out to be Strangles. So the diagnostics really both rely on one of 2 key things. Either you stick a swab into the patient in order to pick up some of the offending organism. And we all know about sticking swabs up our nose and at the back of our throat for the PCR tests and for the lateral flow tests. And they're effectively trying to find evidence of the virus itself. So the reactions in the test tube will happen in a way that picks up proof that there's some of that virus in there. In horses, we can use swabs as well, but we also use endoscopy, so sticking the endoscope, as in this picture at the bottom, into the guttural pouches of horses and picking up not only visual information, but also taking samples that are also then sent for PCR, which looks for evidence of DNA of Strangles, isolating the bacteria, which is what we call culture, so growing the bug in a petri dish. And lateral flow tests aren't that readily available for Strangles. Those that have been developed so far have not been very useful. The horse side tests are still in their infancy, but work is being done to see whether or not in future an owner might be able to take a sample themselves from their horse, pop it into some kind of magic tube, shake it about, and then, like with the lateral flow test, add the drops to a particular little gadget and find out whether Strangles is present. And they might be able to even do multiple tests in the same thing, but this is all some time away. We can also draw blood from our patients. Now, it's important to recognize both with COVID and Strangles that whilst the patient is quite violently affected by the diseases, it doesn't actually form a septicemia where the bacteria or the virus is actually in the bloodstream, where we can actually take a bit of blood, siphon out and filter the blood and pick up signs of the actual bug. So what we're really looking for is how the body has responded to the infection. And in the main, that means we're looking for antibodies. And what that means, both for COVID and for Strangles, is that we're reliant, first of all, on the antibodies being produced. So the host needs to be immune or developing an immunity. Often in Strangles, we will use two blood tests, one at the beginning and one at the later stages of an infection. And we can actually tell the difference with the antibodies going higher and higher between the two samples. That tells us that this horse has actually had a recent exposure to Strangles and it's actually going through the disease, even if the signs are quite mild. But you need to take two tests because you're looking at the fact that the horse's immunity has taken a strong reaction to this. A single blood test, therefore, can sometimes be difficult to know what it tells us. And as I said already, you don't find evidence of the virus or the bacteria in the bloods. And with COVID so far, antibody tests haven't given us much indication that we're getting good immunity, and they haven't necessarily helped us in controlling the spread of infection. And with Strangles, what we are finding is that at the moment, there are some challenges to the antibody test telling us whether a horse is a carrier or not. But actually, it has been a very useful tool in eliminating carriers in the past, and it has the potential again, and we'll come to that later. It also can tell us the status of that horse's immunity, because antibodies in Strangles cases is an indication of how strong the immune system of that horse is. However, saying that, horses that have recovered from Strangles will have antibodies for up to 8 months, we think. But even when they've lost those antibodies, they may retain an immunity based on the white cells, the B cells and the T cells. That'll last for a lot longer, maybe a couple of years. Horses do not have lifelong immunity after recovering from Strangles. And if they seem to be immune over longer periods, it's probably because somebody else keeps topping up their immunity by giving them little doses of Strangles. And we'll come to that in a little while again when we talk about the carriers. So just remember that not all tests that we take for Strangles are equal. Some will look for more than one indication that Strangles is there. So for example, the Old Animal Health Trust test, which is still in use, looked for 2 different antigen surface proteins effectively on Strangles, so that if Strangles had mutated, there was a chance that one of the 2 would be picked up even if both weren't present. So you'll often see blood tests coming back talking about antigen A and antigen C, and that's because that is a double test. So it gives you 2 goes at a diagnosis. Other tests don't do that. They might just look at a whole chunk of Strangles being there, but then that risks overlapping with other diseases that aren't Strangles. And it's also important that the lab that does the tests knows what they're doing. And this is why I've said horse-side tests at the moment aren't particularly effective. The tests are very accurate, but the extraction of the Strangles antibodies or the Strangles bacteria out of your swab, when done at home next to the horse, those automatic systems have so far failed to work. So they either end up with all sorts of junk mixed in with the Strangles, or they filter out everything, including the Strangles. So you can get very frustrating results. So that, and the fact that we've said that antibodies don't tell you the whole story, it's really important when your vets are taking samples that you understand what questions you're trying to answer, and that you add that information to the clinical signs of that horse and other horses around them, and also the background or the clinical history of the yard and the horses. In terms of clinical impact, I think a lot of people would just dismiss Strangles as something the horses need to quickly get over. We've had the same attitude towards COVID, and I think it's important to recognize that that was something which only lasted for a little while before people started to die and suffer really badly, and we realized that we couldn't underestimate the severity that COVID could present to certain members of our communities. And actually, now that we know that there are very mild to more severe versions of Strangles, and that's not necessarily linked to different strains of Strangles, but just that different horses will have different degrees of the disease, that we also mustn't underestimate mild signs when it comes to diagnosing them to try and control the outbreak, similar to COVID. We all know that we're encouraged to get swabs or lateral flow test ourselves regularly, especially when we've got mild signs that are quite vague, like just a fever or a sore throat, whilst other people have suffered horrendously with generalized organ failure. They've been in intensive care for months, and many have died. And we do see death in horses from strangles, although it's much less frequent than with COVID. But again, it's something that you don't want to risk, because nobody wants it to be their horse that is the unlucky one. And of course, the name strangles comes from the fact that the glands at the side of the windpipe can actually get so infected and so enlarged that they can suffocate a horse. And that's where the term strangles actually comes from. In terms of the longer term impact with COVID, we've seen people die quite a long time after they've had COVID, that either appearing to recover and then suddenly getting worse again, or being in intensive care for weeks and months on end and then succumbing to the disease. We've seen people suffer with lifelong disabilities as a result of having strokes, where one side of the body is paralyzed, or they have major organ failure. We know that some people will suffer from long-term debilitation, where long COVID effectively leaves you housebound and unable to do your normal life. But one of the plus sides is that with COVID, once you've recovered, the chances of you being infectious and contagious and passing the disease on to other people is actually minimal. And after a few days, you are no longer contagious to other people. With strangles, it's slightly different. We do occasionally see horses dying, and the two forms of disease that tend to cause this would be purpura hemorrhagica. This is an immune system going crazy, and it's actually not that different to multiple organ failure in COVID. But this often is seen in strangles a couple of weeks after the horse appears to have recovered. And then usually about a year after the horse has recovered, we might lose them to a condition called bastard strangles, where the infections manage to get beyond the head and starts to affect the lymph glands in the neck or the chest or the abdomen. And we'll see here I'm going to play the sound if I can. And you'll see here that this filly was actually lost to the infection. You could hear how her respiration was affected by the pressure on the windpipe from this abscess that was now halfway into the head. But more worryingly was, although we could lance the abscess and treat it from the outside, it had also burst into her esophagus, and that left a permanent hole which stopped her from being able to get food into her stomach, and was something that we couldn't surgically repair, because the recovery rates from those kind of surgeries are very, very poor. Another thing to remember with strangles is that longer term, most horses will no longer be contagious when they've recovered, but actually that's not true. And Strangles has developed this approach to long-term survival to make sure that it gets a chance to get into the next host by coming up with a long-term survival strategy. And we'll talk about that in a minute. And one of the things I want us to sort of address today is how unpleasant is it for a horse to be a carrier, because we often just think of them as fully healthy, look normal from the outside, and it just happens to be that they can give strangles to other horses. But I have actually seen a lot of cases where their own welfare must be one that's compromised as well. Long-term impact, I think there's really good overlap here in terms of what that means. We've learned firsthand what it means to be locked down. Now we can maybe empathize a bit with our horses that are stuck in stables for long periods of time, but we can also empathize with yard owners who have to lock down their entire livery yard for weeks and months on end whilst they get strangles under control. That leads to economic losses for the yard, removes the sort of pleasure that people have for having their horses, like being able to compete or hack out or even to ride at all. And when we think how much we relied on the ability to go and ride our horse or spend time with our horses when we were locked down during COVID, maybe we can appreciate just how tough it can be for them. And of course, with COVID, we've seen that the whole country's economy has taken a big knock, and there will be short-term losses for where people lost their jobs completely. Had there not been furlough, I think it could have been fairly catastrophic. And there will be longer-term damage to the economy that we will have to endure for maybe 5 or 10 years, they say. We can empathize with yard owners who will have long-term economic losses, particularly where the reputation of the yard is damaged, as well as the costs associated with cancelling events, fundraisers, those sorts of things. And of course, this links very much to the Red Wing Strangles campaign, where we want people to be open and transparent about outbreaks and then be praised and rewarded so that the yard reputation is actually enhanced rather than damaged. And I think we've seen a lot of that, mixed reactions around the world, but generally New Zealand was praised for how they approached COVID, as were other countries. And I think taking a proactive and open approach has been one of the best ways in which we can contain infectious disease, whether it's strangles or COVID. The other long-term impact that I think is really important is that we have to recognize that mutations will make it easier for the diseases to carry on. In COVID, we've seen that mutations can happen really quickly, probably linked in part to the nature of the virus, that it produces a lot of virus every time it replicates, there's a chance of a mutation, but also because where the infections have been allowed to spread out of control, the number of opportunities for mutations to happen goes up dramatically. And when that happens, those mutations can then sometimes be successful. And when they are successful, they can become the dominant variant in a community. And then you have to start all over again with your diagnostic test developments or even your vaccine developments. Strangles does mutate more slowly, but it does still mutate. We've seen new strains become the dominant strain in different parts of the world. So one of the reasons why the Animal Health Trust developed blood test isn't as effective anymore at picking up certain types of infection and carriers is because antigen C is a part of Strangles strain that is no longer that common in the UK. So the blood test is still very effective, for example, in Australia and the Emirates area and in America, where the antigen C strain is still very common. Whereas now in the UK, we are relying on the development of new tests to hopefully pick up the strain that is more commonly circulating in the UK. And as I've already said, there is not all tests are created equal, and the work done by the team from the Animal Health Trust is being carried on now by a university in Sweden, and they are taking the forward thinking of the team at AHT. When they developed the blood test, they developed a number of antigens. I think it was 3 or 4 that thought could be useful, that were all specific to strangles, and they are now validating a new test which will look at antigen A and probably going to end up, let's say, calling it antigen D, which will link to the strain that is circulating more commonly in Europe and the UK. So that will allow that blood test to become more accurate and reliable again. Mutations can obviously therefore lead to a blood test or a swab coming back negative when in fact you've got the disease. And that can lead to serious misjudgments and the wrong decisions in terms of lifting quarantine. And therefore we do need new tests to be in development. But as I've just alluded to, there is one going on for the blood test for strangles. But there's also a significant impact on the effectiveness of vaccines when you've got mutations creeping in. We all now are quite familiar with the concepts of isolation and quarantine. Strangles quarantine is very much focused on physical distance and separation, very much like social distancing in the COVID outbreak. Masks in horses are not practical and don't actually help because it's not an airborne disease, thankfully. Therefore, we don't have to mask up our horses, but we do disinfectants and distance and cleanliness and hygiene of the yard as very big components of our isolation strategies. So this leads very nicely into the prevention of the two conditions. We talk about trying to suppress the infection in a population, and that applies to both the diseases. And those are really very much the same principles all the way through. So we've talked about isolation and distance. With Strangles, just 5 meters can be enough to stop an outbreak spreading through a yard, which is really quite remarkable. Whereas with COVID, it gets a lot more complicated. Outdoors, 2 meters is probably enough. Indoors, in the same space, without masks, 2 meters is probably not enough. Masks in COVID are really effective at stopping infected people from exhaling large quantities into the atmosphere. And for our hospital staff, the higher level PPE masks, the Mark III level of protection, can stop them inhaling virus particles. But with horses, that's unrealistic and not pragmatic. And we've seen in hospitals how much the NHS staff are at risk if they don't have really comprehensive PPE, pretty much looking like they are in a hazmat suit. And with horses and Strangles, we rely on overalls as well. We can have rubber overalls and coats, which can be easier to disinfect. We can use things like separating the horses out into separate groups, not going in, keeping your equipment separate. These principles all apply to the COVID work that's been going on. And obviously there's the reliance on disinfectants for killing off any virus or bacteria that has potentially got through all the other layers of protection that you've got. When it comes to immunity, getting potential victims or hosts to become immune, we all know how badly that idea went of getting herd immunity by letting COVID burn through the population. The downsides can be that you can lose significant members of your community, and that is obviously for the COVID outbreak and for us as humans unacceptable. And in Strangles, most owners will find that unacceptable, putting their own horse at risk, even if they might feel that in other situations it's okay to let Strangles burn through. But it is one of the areas where we do need to get people to change their perceptions and their attitudes towards Strangles and how to get herd immunity. With COVID, we've seen vaccine development as an imperative, and that the development has been incredibly fast, and therefore we've ended up with effective vaccines really quickly. But that's come thanks to huge financial investment, able to turn science that was already on the cusp of making these vaccines achievable to actually giving them a go for the first time in the real world. And so the AstraZeneca and the Pfizer vaccines broke new ground, whereas other vaccines have used traditional technologies to produce safe and effective vaccines. With Strangles, we've had vaccines around for tens of years. They've had variable success. They've either been quite effective, but had side effects like causing abscesses, or they've had very short durations of immunity, or they've required you to put the injection into the horse's top lip, all of which have caused problems and have ended up leading to those vaccines not being used that widely. We're really looking forward to the release of a new vaccine, Strangvac, which will hopefully be available in the UK at the end of the year or beginning of next year. It's taken a long time to get there, and sadly it has mostly come from investment from the charity sector into the Animal Health Trust, and then finally finding a company who was willing to take it on as a commercial enterprise. And we now have to see how good this vaccine will be and how effective. But I think it's really interesting to see the contrast in how many years it took to get a Strangles vaccine this far compared to the COVID vaccines. And now I just want to talk a little bit about my pet subject, which is the carriers of Strangles, because it is the survival of the bacteria in the guttural pouches that is the way in which Strangles manages to get from one horse to another long after the horse has recovered from acute Strangles itself. So the guttural pouches basically are a modification of the tube that connects the inner ear to the throat. In the horse, the inner ear connection is closed, but it's the same tube that we use when we go up and down in aeroplanes or up and down mountains, and we sometimes have to swallow or blow our nose in order to open that tube up to get air pressure the same on either side of the eardrum. In horses, this has turned into quite a big cavity. So relative to the horse's skull, it's probably for an adult horse the size of a fist or bigger. And for a pony, it's probably the size of a fist and smaller, depending on the size of the pony. But you can see that they're actually quite significant structures from these couple of pictures. And importantly, not only are there a lot of very important blood vessels and nerves going around them and through them, but also there's a gap between the left and right compartments of the pouches where the stylohyoid bone supports the tongue. And also the lymph nodes of the head protect the horse from getting infections in the lungs, so protect them from pneumonia by picking up bacteria. So we've got lymph glands all the way along the tongue, underneath the tongue, so that's under the jaw where the infection often breaks out, either side of the back of the jaw, and all the way around the guttural pouches. And it's when these lymph glands get infected, they become abscesses, and then they need to burst somewhere. And mostly under the jaw, they'll burst out underneath. Mostly the salivary and parotid glands will burst out through the side of the head, just below the ear. And the ones that happen in the pharynx will burst into the guttural pouches. And in fact, the nasal discharge in Strangles comes from the pus trickling down from the guttural pouch into the throat and then down the nostrils, not from a pneumonia or a chest infection. So what's important, I think, to recognize is the opening of the guttural pouches, as you can see, gets narrower, and it's also flattens. So it becomes almost the size of a pencil, and it's normally squished shut. So pus will only trickle out when the horse is allowed to have its head down, and it'll only trickle out when the pus is liquid. And as horses recover, what we find is that the pus coming out of the lymph glands around the pouches gets thicker and thicker, and it eventually becomes very gooey. And then it suddenly stops running out of the pouches. And this is when trouble strikes, because the Strangles bacteria can live inside those pouches, inside that pus, and they can survive in there for years and years and years. However, every now and then when that horse gets stressed, the lining of the pouch will potentially release a bit more mucus. That will trickle over the bacteria and carry them out from their home in the pus, down the guttural pouch opening, down the horse's nostril, and into the water tank and infect the next horse. And that's how carriers infect new groups of horses. And that's how outbreaks start when you mix horses and when you introduce new horses to a yard. So the important thing to remember is that if you don't check after a horse has had Strangles as an acute infection, there's a good chance that there will be pus retained in the pouch, and that pus will contain living bacteria of Strangles for potentially years. And I've just helped a herd of ponies where 1 in 3 ponies had huge quantities of highly infective pus trapped inside their pouches. And I'll show you a couple of videos of those now. I'm hoping that the videos don't put you off getting your horse scoped, because a quick scope of a healthy horse to check that they're okay is really not a problem. It's even less upsetting to most horses than doing a COVID swab. What I would say is, if your horse is a carrier, if they've only got a small amount of pus, it's something that can be fixed by an experienced vet in 20 minutes to an hour. So it's really not that stressful. But if you don't check, and my personal recommendation now is to get your horse checked about 10 days after they've recovered from Strangles. It's sooner than the general advice. It might mean that you have to test your horse more than once. But if you catch them around about 10 days after they've recovered, the pus will still be liquid, and you can literally just hose it out of their throat, get it out of the pouches by pouring water in through the scope. It'll run past the scope, down the nose, into a bucket, fill it with disinfectant in the bucket, and your horse will cleanse itself. Sometimes you've got to go back because the lymph glands are still draining another week or 2 later. But if you leave it 2 weeks, 3 weeks, 4 weeks, that pus can start to turn solid, and you'll see in a minute how horrendous it then is to try and fix for these horses. So this is a view inside the pouch of a big Shire horse cross called Benny. He holds the world record for the number of chondroids in his head. So we started to pick these out one by one, so we can get them out one by one with a basket. And you'll see this basket in use in a minute. It goes through the scope, it opens up. There's different shaped baskets, but the one we've got is like magic, and you can catch this chondroid in there, tighten the basket, and then you pull the basket and the scope out. And if the chondroid is nice and firm, it comes out the head. But after we'd done a dozen or 2 dozen of these, we just realized that actually there was about 10 centimeters deep of chondroids, because Benny's a big horse. And in the end, I think we got over 210 chondroids out of his head, both all during a surgery that we did. And that's on top of about 30 or so chondroids that we got out using the scope leading up to that point. Now, I'd just like to show you some of the kind of work that we've been doing recently. You'll see here that in the guttural, in the pharynx, the back of the throat, we've already done some work. So there's flakes of pus. These horses were found too late for us to rinse the pus out, but they were already semi-solid. So we couldn't flush them out, but they were not firm enough for us to grab and pull out. So every time we grabbed them, they just crumbled. So what we had to do, and to get the scope into the pouches, we use a wire which is soft and blunt. And then once that's in the pouch, the scope will follow that in. And once we get into the pouch, we can then see what is left to do. And I'm hoping that you'll appreciate from this video, similar to Benny's, that entire guttural pouch looks really unhappy. The lining is thickened, there's a lot of froth, and it's often red and inflamed. And often we've seen ulcers as a result of the pain caused by or ulcerations caused by the long-term presence of these chondroids. And in many cases, those ulcers are then obviously very painful. So you can see here that every time we go in, we have to clean the lens of the scope so that we can see what's going on. This mess that's in there is very frothy, so the work for the vet gets much more difficult, having to navigate around this sort of soupy concoction. And this is all pus that's now too solid to run out, but actually too crumbly to grab in a single go. So what I'm going to show you here now, just advance the video a bit, is coming out with the basket and opening it up. All we can do is try and scoop up, and it's mostly done blindly, as much of the pus as we can, and then we close the basket and effectively we sever that pus into 8 pieces or 10 pieces, depending on your basket. And then we have to start again and again and again. These videos were about 45 minutes a piece, and some of these horses needed to be done on both sides, and it took us sometimes 3 or 4 hours over a number of days to fix these horses. And you can imagine the difference in the vet bills between 1 or 2 flushes, just rinsing out the mess, and having to take on these kind of cases. And I have to say, a lot of vets will not be comfortable doing this work. It takes quite a bit of practice and experience, because we just haven't been doing it that commonly. And recently I've come across cases that have used every last bit of experience I've got in order to try and help them. And I think, if anything, that should be a lesson, that avoiding strangles is far more beneficial and cost effective than trying to cure it. So the reason I've let this video run on and on is that this is the other pouch on the same pony. And I hope you can appreciate how much healthier this pouch looks. You can actually make out the blood vessels, the fat. You can see in the middle there the stylohyoid bone that runs down and divides the pouch in 2, where the tongue is supported. You can see the carotid artery branches. And thankfully, you can also see that this pouch is nice and clean inside. So there's a little bit of liquid in there that's come from the rinsing of the scope, but actually this is a very healthy pouch. The only reason it looks a little bit small and collapsed is because of the amount of air that's got into the pouch on the other side. And now we will look at another pony where we thought we might be able to pull out these two chondroids. This was a foal. So this was a few weeks after the horse had recovered from the infection. And we thought that with our snazzy basket, it would just be a matter of minutes to grab the chondroid. And you can see there that we're doing quite well. It's almost within the basket already. But then the minute we start to close the basket, all that ends up happening is that it breaks into little pieces. And then you basically have to keep going until those little pieces are broken up completely so that they are small enough that when you rinse water into the pouch, they will manage to fit out the gap and run out the pouch by themselves, or that they are small enough for you to suck them back up through the endoscope. And that means that they have to end up being smaller than 2.5 millimeters in order to suck them back into the scope, which is actually really tiny. And you can see here that the mushing and flushing technique is tedious and time consuming, and you think you've done it all, and then you still end up finding big chunks that don't want to come out. So again, for me, as much of an incentive to try and avoid getting into this situation as any that I would need to just scope my horses soon after they've recovered. And we're going to just move on here now to, this is edited down from about 45 minutes, but what you'll see here is that eventually it is quite easy to get the chunks into the basket. These baskets cost about £300 each, and they're meant to be used once in humans, but we are able to recycle them in the veterinary world. So they are actually quite a good investment for vets that have to deal with an outbreak. And we've posted some of our Red Wings baskets around the country to lend them to vets who find themselves tearing their hair out with complicated cases. So some of our baskets are more well-traveled than the horses that they've helped. I'll just jump forward a bit here to what I want to illustrate is once you start to make progress, you can still see that the pouch is quite reactive. It's thickened. Apologies for it being on its side. But this is, I think, on the other side of the same pony. And so we have to do the same work all over again. So sometimes you're lucky and it's just the one pouch that's affected. And I'm conscious we're coming to the end of time. So after some mushing and flushing, we've done a bit of rinsing, and you can see that although everything's upside down at the moment, we are able to break these pieces down. And the swirling around is because we're injecting lots of water in through the scope, and then it comes running down the horse's nose into a bucket. They really need to be heavily sedated for this. So often they're sedated 2 or 3 times during a procedure so that they aren't stressed by any of it. And then we will just move on. And this is what's, I think, really quite a unique and helpful view. This little dimple is actually what's left of the drainage hole. So the lymph gland is actually sitting just on the other side of that membrane. And we have even seen horses where you can see the pus oozing and running out of the lymph gland into the pouch. And it's worth remembering that some horses will still continue to discharge pus into their guttural pouches for weeks after they've recovered. And sometimes you won't see any snot coming down the nose anymore, because the minute it runs down the nose, the horse will swallow it. But these horses can still be contagious. So it's really important that when your horses started to recover, you start to consider diagnostic testing, but maintain quarantine until you know that they are absolutely not contagious to other horses. And then you can see here that at the end, we are almost finished with getting rid of all the junk. And I hope you can appreciate, from really quite massive chunks of pus, we're now looking at what is quite a healthy guttural pouch lining in terms of There's not a lot of inflammation, although it is swollen, but over a few weeks, this guttural pouch should recover totally by itself. And for me, that, is the reward of standing there for 2 hours, struggling to overcome. And then I think we're pretty much on our last little video. So this is going into the nose of a horse that was heavily infected in 2 guttural pouches. This is an adult horse, and we eventually gave up just trying to flush out through the scope. And one of the techniques we use is a Foley's catheter. So this is a rubber tube designed for use in humans, and it's got a little balloon behind the openings that you can fill up from the opposite end of the catheter. And when you expand that, the balloon keeps it in place. So it's used in human bladders, and we use it in horses for the guttural pouch. So it takes a bit of a knack to stick it on the end of a plastic stick that's been bent, and then you've got to stick it up the horse's nose. And then once it's up the horse's throat, you then have to swivel it around, and then you catch it under the horse's guttural pouch flap. Then you push it in, and then you inflate it. And this is the scope going back up now. Now that the catheter's in, we've done a lot of flushing and we've got a lot of junk out, but we realized that there were still some very big pieces in there. And thankfully, because this was a bigger pony, we were able to actually get the scope in alongside this tube and slipped it back into the pouch. And you'll see here now the big balloon that stops it from falling out of the pouch. And then you'll see the hole in the end of the tube that allows us to suck out the little bits and pieces. But you'll also appreciate that some of the chunks are still pretty big, and they are bigger than the hole in the tube. They're bigger than the diameter of the tube. So we still have to do some breaking up and flushing, which is why these things can take hours and hours. And again, you can appreciate how thickened the lining of this horse's scope is. You can just see one of the holes there that we have to try and get those chunks to fit through in order to clean the horse out. So it does take a lot of patience and repetitive work. And I think you'll just see us now coming out of the pouch with the scope, and we were able to then progressively empty this horse out so that hopefully next time we go back, she will be 100% clean, or certainly negative, because we stopped once we'd cleaned her out completely. Just talking for the last 2 slides about vaccines. There has been obviously hesitancy. People are always nervous, especially if they're scared of needles. There's the anti-vaxxer movement, which is, really an anti-science movement, which is preying on people's fears and tendency to believe conspiracy theories if the theory fits in with our own beliefs and prejudices. We've seen the risk posed to vaccine effectiveness from mutations for COVID. And so we've had to manage people's expectations because vaccinated people have still become ill. We've realized that the immunity given by vaccines doesn't last as long as we'd hoped. And so we are doing the booster program now. And with Strangles, we realized that an important factor is the cost of vaccination for owners. And so hopefully the Strangles vaccine can be done alongside the flu vaccine, so it's on the same vet visit. We want to know how much improvement do we get off the back of our investment. So how much does it cost and how much are we going to get for that? What is the risk of mutations making the vaccine in Strangles ineffective? And hopefully I've reassured you that the mutation is slow, so it'll last. I think we'll be able to stick with that vaccine for a lot longer. And what we have to see is that it probably also won't give us 100% protection. And we'll have to see over time how long horses are protected for when they're in the middle of an outbreak. And then finally, we have to consider the human element. With COVID, it's been absolutely critical to see that we are open and transparent, that people do the right thing and isolate themselves, and that people think about their community rather than just themselves. And with Strangles, our whole campaign has been to try and stop people hiding that they've got an outbreak and that they actually speak out. and that they build a community spirit in the same way that we've seen through COVID. And obviously we see the need for a partnership approach in the same way with Strangles and COVID, if we want to either get over an outbreak or to prevent one. So maybe these two gory pictures will motivate you to realize that Strangles is a disease that has real consequences for our horses, not only for us as owners, the damage it does to our enjoyment of the horses, but that it can be quite a lot for the horses to endure and for their treatment. If we can learn lessons about how we've changed our behaviors through COVID, we can apply the same lessons to our way that we look after our animals, our livestock, our horses, our pets. And when another disease comes along that isn't Strangles, or if it's Strangles, we can be better prepared and quicker to act, and maybe just also have a much more humble attitude to the fact that this is going to be something that we don't really want to do, but if we do it and do it well, we will be rewarded for it. And if you want to, there's a lot of resources, and we keep our website up to date. And so as new knowledge is learned, I would suggest that it's better to take your up-to-date information from our website rather than from this talk or any notes that you've made in 1 or 2 years' time, because we'll know a lot more about the vaccine, for example. And actually the page that's there for vets has got PowerPoint presentations for them to use, but there's also interesting videos on endoscopy. So that's not a bad link for you to follow. So apologies, I have run over, but thank you very much for your attention. And if there's time, I'll happily answer some questions.
Nic, thank you so much. That was fascinating. Really, really great. Really so interesting to see how we can learn from COVID and what we can all be doing. Let's see. I'm just going to see if any questions come in. What I would love to ask you though is, what is, hard question, if you could give us one thing we could all perhaps do a bit better now that more shows are opening up and we're all out and about with our horses. What's your kind of bugbear? You know, Kate was talking about this communal water trough earlier and everyone's horses having a good dunk in. Is there one thing we could all just be a bit more sensible about with our horses to help reduce the chance of Strangles? I appreciate maybe more than one thing. Yeah, if you could answer that'd be fab.
The top one, which is cheating, is to follow the science, but actually understand what's going on. And if there's a flu outbreak or a Strangles outbreak in the area, learn about the disease and follow the guidance specific to that disease so that you're effective. If there was one thing specifically I would do, it's to respect other horses and your own horse by staying away from horses you don't know when you go to shows, not in the way that it spoils any enjoyment of being out at the shows, but where you don't know what's going on, where you're not sure if there's an outbreak, where your horse isn't fully vaccinated. If you stay away from other people's horses, avoid sharing spaces, water troughs, that kind of isolation, separation, social isolation, which is very much contrary to good horse welfare. But in the context of something like a show, that's where Strangles spreads. And it's new and unfamiliar horses. So in next year, I would say get your horse vaccinated. This year, I'm going to say just respect distance between your horse and other horses until we've got better things.
Yeah, definitely. And that's a great takeaway. So horsey social distancing if you're at a show. Fantastic. Quick question about Benny's success back to normal work or with other horses. After a horse has Strangles, like what is the prognosis? Are they likely to be going back to work? You know, recovery rates must vary in length of time. But yeah, it'd be lovely if you could just give us a little bit of information on that.
So the whole reason I do all of this is because, and my puppy's decided it's time to wake up, is that I think it is curative. So they're no longer contagious to other horses. They are no longer going to be the social pariahs, but they also can carry on a normal life. And the guttural pouches inside look completely different once you've done that. And let's see, the distracting toy works. So I think their throats must feel so much more comfortable, and no one's really done a study, but I would worry that my horse is actually suffering discomfort, and maybe its performance is actually inhibited because of the fact that it's got a really inflamed guttural pouch. And I think we have seen horses struggle to swallow, and when we fixed their pouches, they've gone back to normal, put on weight again. And Benny did actually make a full success. He had a bit of a rocky recovery from the anesthetic, but once he was back up, he was fine. And he didn't last many years, unfortunately, but that was related to his age and his arthritis that crept up quicker. But in himself, he was 100%, and he was out in the fields living with other horses. And all of our horses we've treated, where we've got rid of the strangles, which is pretty much everything these days, have gone on to lead normal lives.
Oh, brilliant. That is really, really inspiring to hear. Thank you so much, Nic. Well, I don't think we have any more questions for you, Nic, so we'll let you and your puppy enjoy the rest of your Saturday, but lovely to see you. Thank you so much for joining us.
Thank you.
Just going